Imagine you're at a family get-together, perhaps a barbecue, and you notice your father is breathing heavily, sweating profusely, and suddenly falls to the ground. What are you going to do for him? While this scenario is only a nightmare for most of us, it can become a very possible and very scary reality. Knowing what to look for and assess in these types of situations can be vital into saving that person's life. And I'd like to share with some of those basics with you here today. Through nursing school, I've been able to refine my skills of assessment through constant practice and learning, and I'd like to share that kind of stuff with you today. You never know when you'll be able to use it, but it could help somebody. First thing we're going to look at is the pulse. Sure, we all have heard of the pulse before, but do we really know what it is? Well, the pulse is one of two components that helps measure the output of the heart. The heart rate is how many times the heart actually expels blood to the rest of the body. By definition, it's the total number of palpated, that you felt with your fingers, right here, or auscultated, listen with a stethoscope, beats per minute, and that's what we consider the heart. The normal ranges for healthy adults is 60 beats to 100 beats per minute. The more physically active you are, generally the lower your heart rate is, due to the fact that through all that training, your heart has become much stronger. It doesn't have to pump as much. But there's a dangerous condition known as bradycardia that can be very dangerous. It causes fainting, weakness, and loss of energy. And it's caused by some dangerous things. So it's something you really have to look out for. The second thing we're going to look at are respirations. And respirations essentially is just the number of times a person breathes in and breathes out in a minute. So in respiration, it's just, so when we breathe in and out, the motion of breathing expands the chest, expands the lungs, allows oxygen to enter, and then when the muscles contract, we expel the CO2 into the atmosphere. It's important to be able to monitor respirations because the breathing rate can show early signs of exacerbations of known or unknown heart and lung conditions, as well as drug overdoses and strokes. So it's really important, good thing to know. So, into assessing. I know we've all seen a pulse taken on television and in the movies before, but if you actually had to do it, would you know what to do? Okay, let's go over it. So first off, there we go. This is how we're going to do it. We're going to go with the most commonly used, the radial artery, which lies right here along the radial bone. You're going to take your index and middle fingers, feel for the groove at your radial bone, and nope, there it is. And there it is. It's a nice divot. You'll be able to feel the pulse. It's always on the side of the thumb. So if you ever look, never look with the pinky, always with the thumb. You're going to do that for 15 seconds and multiply by 4. And that's how you get the pulse. Anything above 100 is called tachycardia and is dangerous. Anything below 60 is called bradycardia and is equally dangerous. And we're going to talk about some of the causes and how to help in an emergency situation a little bit. With respirations, it's much more straightforward. All you're doing is looking at the person's chest and monitoring inspiration and expiration. So with every cycle, that's one respiration. Notice I inhaled and exhaled. You do the same thing, you count for 15 seconds, multiply by 4. What you're looking for is anywhere between 12 and 20 for a normal breathing rate. Anything below is normally caused by drug overdose or very possibly a stroke. It's very serious. Anything above can be caused by different things that we'll talk to later. So if you find this person and they have an elevated heart rate and it's not because of exercise, there's a very common thing that we can all easily help treat is to find if they're dehydrated. Because if they're dehydrated, the loss of fluid coupled with an electrolyte imbalance is going to send the heart in all crazy rhythms. It can send it super fast, it can even drop it down, so this works for both. What you're going to want to do in this situation is give fluid if possible, and if possible it's ideal to give electrolytes such as sports drinks like Gatorade, and they'll be back to good in no time. Then if you find somebody with bradycardia, it's generally an underlying cardiac arrhythmia such as heart block. The heart rate's going to slow due to conduction problems within the heart itself, and it's going to force the heart to take a longer time to fill and contract. The body gets an inadequate amount of oxygen, keeps slowing, eventually it might stop. You need to get this person to a hospital, so you want to call 911 immediately. If you find somebody who's having abnormal breathing, you want to find out if it's hypo, under 12, or hyperventilating, over 20. because there's two different things for each of them. If it's hyperventilating, they could be suffering from a chronic lung disease that's being exacerbated, such as asthma or COPD. And if this is the case, you're going to want to ask them if they have any medication on them, such as inhalers or epinephrine. In these cases, if not, then there's the only thing you can really do is try and help them calm down and call 911, because those are really the only things that'll help. Also, it could be, if you can find out from them if they're diabetic, it could be a complication of diabetes known as diabetic ketoacidosis. In this case, there's a loss of electrolytes, and the blood sugar is way too high, and your body just starts to shut down. Your respirations become very increased. So what you're going to want to do is, if they are diabetic, try and give them insulin, see if they can walk you through it. If not, you're going to want to give them electrolytes, so Gatorade and things like that again, and call 911 for them. And then if they're hypoventilating, there's normally only two real causes. Most commonly, it's a drug overdose of narcotics or benzodiazepines, so like pain medication or anxiety medication. In this case, if you can find the bottle, that'd be ideal. Call 911, tell them what happened, and that's all you can really do at that point. Try and make sure to keep the airway open. Roll them on their side in case they vomit. Another possibility would be to see if they had a stroke affecting the brainstem. You could notice this possible by a drooping of one side of the body, or a lack of use of one side, and this is extremely important. Time is of the essence in these situations, so ideally you would want to put that person in the car and drive them to the hospital yourself. So over the past couple of minutes, I've shared with you the basics of vital sign assessments, normal findings, and interventions. These skills are extremely useful to me in my field, but it's not exclusive to that field. I hope that I've taught you some skills today that may help you to assist some people later in life. Thank you, and have a great day.